Hey guys, welcome back to the channel. Today, we're diving into a real-life case study of prostate cancer, how it progresses, what the treatment options are, and what this means for patients like Martin. Now, if you or someone you know has been diagnosed with prostate cancer, you're not alone. In fact, prostate cancer is the second most common cancer in men worldwide, with over 1.4 million new cases diagnosed each year. Early detection can make all the difference, so let's break this down step by step. Meet Martin, a 70-year-old gentleman who's been managing his prostate cancer with active surveillance since April 2023. When he was first diagnosed, his PSA levels were 5.79, and his cancer was classified as T1, Gleason 3+3, which is considered low risk. For those unfamiliar, PSA stands for prostate-specific antigen, a protein produced by prostate cells. Higher levels can indicate cancer, but also other conditions like an enlarged prostate. Now, the average PSA for men in Martin's age group is around 4.0, so his numbers were elevated but manageable. Fast forward to August 2024, and things started to change. Martin's PSA climbed to 8.19, and biopsy results showed that his cancer had progressed to Gleason 3+4, meaning a mix of slower and moderately aggressive cancer cells. At this point, his doctors had to make a decision: continue monitoring or begin treatment. After discussing options, Martin decided to go ahead with radical radiotherapy, specifically 36.25 Gray in 5 sessions over alternate days, and notably, without androgen deprivation therapy, hormone therapy. But here's the interesting part. MRI scans between March 2023 and May 2024 showed no significant change in the appearance of his prostate. No measurable disease outside the prostate, no new worrisome lesions, and no signs of cancer spreading to lymph nodes or bones. So, how do we explain the rising PSA and biopsy changes? Well, PSA can fluctuate for various reasons, and sometimes microscopic changes in cancer cells don't immediately show up on imaging. This is why biopsies remain crucial in tracking disease progression. Now, let's talk biopsy results. Out of 6 biopsy cores taken from the left side of Martin's prostate, 5 were involved with cancer, with a maximum length of 7 millimeters. However, none of the right side cores showed cancer. This tells us the disease remains localized, which is good news for treatment options. Had it spread beyond the prostate, treatment would have been much more complex. One important factor in Martin's treatment plan is his overall health. While he doesn't have major urinary symptoms, he only wakes up once or twice a night to urinate and has a normal flow. He does have significant heart and lung issues. Martin has a history of ischemic heart disease and underwent a coronary artery bypass graft in 2016. He also suffers from COPD, which makes him breathless even after climbing 1 flight of stairs. This means that hormone therapy, which can worsen fatigue and cardiovascular risk, was not an ideal option for him. So, after weighing the pros and cons, Martin opted for radiotherapy in 5 sessions, a relatively new approach designed to deliver an effective dose while minimizing side effects. This method has been gaining popularity, with studies showing that ultra-hyperfractionated radiotherapy can achieve similar cancer control rates to traditional long-course treatments, but in a much shorter time frame. For example, the HypoRTPC trial followed 1,200 men and found that 5-session radiotherapy was just as effective as the standard 39 to 42 session protocols, with no significant difference in side effects. That's a game changer for patients who want a faster, more convenient treatment. Martin is retired and lives with his wife, who has been a great source of support. He worked as a car mechanic and later as a gardener, staying physically active throughout his life. Despite his health issues, he maintains a good diet and drinks about 6 cups of green tea a day, which, by the way, is rich in antioxidants that may offer some cancer-fighting benefits. Interestingly, Martin has no notable family history of prostate cancer. But given the progression of his disease, he and his doctors decided treatment was the best option. His radiotherapy is now scheduled, and he's hoping to start within the next couple of months. So, what can we learn from Martin's story? First, active surveillance is a great option for many men with low-risk prostate cancer, but it requires regular monitoring. Second, PSA levels alone don't tell the full story. Biopsies and imaging are crucial. And finally, treatment choices need to be personalized based on a patient's overall health and preferences. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more real-world case studies and health insights. And if you or a loved one is facing a similar situation, drop a comment below. We'd love to hear your thoughts. Thanks for watching, and stay healthy.